You constantly feel like you have mucus stuck in the back of your throat. You clear your throat dozens of times a day. You've tried allergy medications, decongestants, and nothing has worked. Here's why. What you're experiencing is almost certainly not mucus. It's not post-nasal drip. It's not allergies. What you're feeling is something completely different, and until you understand what it actually is, you'll never get rid of it. I'm going to explain the real cause and give you a 3-step protocol that can eliminate this problem within 4 to 6 weeks for most people. This is based on research published in medical journals, including the Annals of Otology and the American Journal of Gastroenterology. By the end of this video, you'll know exactly what's happening and what to do about it. This is educational content, not medical advice. Always consult your physician for diagnosis and treatment. Now let me tell you what's really going on. When you complain of constant throat mucus, doctors typically diagnose one of 3 things: post-nasal drip, allergies, or chronic sinusitis. They prescribe antihistamines, nasal sprays, or antibiotics. You take them for weeks or months with minimal or no improvement. Here's the shocking truth. A study published in Otolaryngology examined 182 patients diagnosed with post-nasal drip. When specialists examined them with advanced diagnostics, 87% did not actually have significant post-nasal drip at all. So what did they have? The answer for most people is laryngopharyngeal reflux, or LPR. This is sometimes called silent reflux. You've heard of acid reflux, or GERD, which causes heartburn. LPR is similar but different. Stomach acid travels up and reaches your throat and voice box. These delicate tissues are extremely sensitive. Even tiny amounts of acid cause massive irritation. Your body responds by producing protective mucus and inflammation. This creates the sensation of something stuck in your throat. But here's the critical point. The sensation you're feeling is not mucus that needs to be cleared. It's inflammation from acid exposure. This is why throat clearing doesn't help. You're trying to clear something that isn't actually there. In fact, throat clearing makes it worse because it causes additional trauma to already irritated tissues. Here's what makes LPR so tricky. Unlike GERD, you don't get heartburn. Research shows only 30 to 40% of LPR patients have heartburn. The majority have throat symptoms only: chronic throat clearing, mucus sensation, chronic cough, hoarseness, or the constant need to sip water. If you've been diagnosed with post-nasal drip but medications haven't helped, there's a very high probability you actually have silent reflux. And the good news is, it's treatable. Here's the 3-step protocol to eliminate throat mucus caused by silent reflux. These steps are based on treatment guidelines from the American Academy of Otolaryngology. Step 1. Eliminate dietary triggers. You must stop consuming foods that trigger reflux. For most people, this alone produces improvement within 1 to 2 weeks. Foods to eliminate for 4 to 6 weeks. Caffeine, including coffee, tea, and energy drinks. Caffeine relaxes the valve that keeps acid in your stomach. Alcohol, all types. Chocolate, mint and peppermint. Carbonated beverages, including sparkling water. Citrus fruits and juices. Tomatoes and tomato products like pasta sauce and pizza sauce. Spicy foods, fried and fatty foods, and raw onions and garlic. I know that's a long list. What can you eat? Lean proteins like chicken, turkey, and fish. Whole grains like oatmeal, brown rice, and whole wheat bread. Most vegetables, especially greens. Fruits, except citrus, bananas, and melons, are excellent. Low-fat dairy. Healthy fats like olive oil and avocado in moderation. Eat smaller, more frequent meals instead of large meals. Large meals increase reflux. And this is critical. Do not eat within 3 hours of lying down. If you go to bed at 10 p.m., your last meal must be by 7 p.m. Step 2. Lifestyle changes. Elevate the head of your bed by 6 to 8 inches. Not with pillows. You need to elevate the entire head of the bed with bed risers or a wedge under your mattress. A study found this reduced nighttime reflux by 67%. Lose weight if you're overweight. Even 5 to 10 pounds makes a significant difference. Stop smoking if you smoke. Wear loose clothing around your waist. And manage stress through meditation, walking, or whatever works for you. Step 3. Consider short-term medication. For many people, diet and lifestyle changes are enough. But if your throat has been irritated for months, medication can help during healing. Proton pump inhibitors, or PPIs, like omeprazole, which is Prilosec, reduce stomach acid production.
For LPR, take a PPI twice daily, 30 minutes before breakfast and 30 minutes before dinner for 8 to 12 weeks. PPIs are a bridge to allow healing while you fix the underlying causes with diet and lifestyle. They're not meant to be permanent. Research shows patients who combined PPIs with diet and lifestyle changes had 85% improvement within 12 weeks, and most discontinued medication after that while maintaining relief. Now, the timeline. Week 1, you may notice some improvement but still have symptoms. Weeks 2 to 3, significant reduction in throat sensation and less throat clearing. Weeks 4 to 6, major improvement. The chronic problem is greatly reduced or gone. Weeks 8 to 12, symptoms are resolved or minimal for most people. The key is consistency. You can't eliminate triggers during the week and binge on pizza and wine on weekends. Your throat needs consistent relief to heal. Let me highlight the absolute worst offenders because some might surprise you. Coffee on an empty stomach is terrible. It's acidic, has caffeine, and stimulates massive acid production with nothing to buffer it. If you start your day with coffee before eating, this is likely your biggest trigger. Orange juice. People think it's healthy, but it's extremely acidic, like pouring acid on inflamed throat tissues. Wine, especially white wine and champagne. Acidic, relaxes the sphincter, and carbonated in champagne's case. A triple threat. Tomato sauce, concentrated acid plus garlic and onions. If you eat Italian food regularly, this is a major contributor. Peppermint tea. People drink it thinking it's soothing, but peppermint directly relaxes the valve, allowing acid to flow up. And late-night eating. Whatever you eat before bed guarantees nighttime reflux. The 3-hour rule is non-negotiable. Foods that help. Oatmeal, bananas, melons, green vegetables, ginger tea that's caffeine-free, lean poultry, and whole grains. Your diet is either healing your throat or damaging it. Choose healing foods. Let me give you when to see a doctor immediately. If you have difficulty swallowing that's getting worse, pain when swallowing, unintentional weight loss, persistent hoarseness over 2 weeks, blood in saliva, severe chest pain, or you've done this protocol for 12 weeks with 0 improvement, see a doctor for proper evaluation. For everyone else, here's your action plan starting today. Clean out your kitchen. Remove trigger foods. Stock up on throat-friendly foods, oatmeal, bananas, lean chicken, vegetables, brown rice. Elevate your bed tonight. Order bed risers or a wedge pillow today. Set an eating cutoff time 3 hours before bed. No exceptions. If you drink coffee, quit for 4 weeks. The relief in your throat will be worth it. Keep a symptom journal to track what you eat and how your throat feels. This helps identify your specific triggers. Be patient and consistent. Your throat has been irritated for months or years. It will take time to heal. Stick with the protocol for the full 8 weeks. Imagine a few weeks from now, your throat feels clear. You go through your entire day without clearing your throat once. You have conversations without that constant urge to cough. That is absolutely achievable for you. The stuck mucus feeling can be gone. You just need to treat the real problem, silent reflux, not the misdiagnosis of postnasal drip. If this helped you, subscribe to this channel for evidence-based health information that solves real problems. Comment below how long you've been dealing with this and commit to trying the protocol. Come back in a month and tell me your results. Your throat affects your ability to eat, speak, breathe comfortably, and sleep well. Don't accept constant irritation as normal. It's fixable. Start today. Eliminate the triggers. Make the changes. Your clear, comfortable throat is waiting. Thank you for watching, and take care of yourself.